Okay. Okay, I hope I did that right. It talked back to me, so it must be doing something. So, welcome, and I would just acknowledge that we're all on unceded Indigenous lands of various different tribes and Indigenous groups, so we just need to be mindful of that. I also wanted to just start by acknowledging that this has been one heck of a summer. For all of us, I think. If we weren't burning up and going up in smoke, we were having to breathe smoke. And then it turned really, really, really hot, which had its own issues and problems as well. So, and then the Delta variant raised its ugly head, and it's changed the pandemic very significantly. So the fact that we're still able to provide some services to our communities, I think, is nothing short of miraculous, given the constraints that we've been bumping up against for sure. I'm just going to share my screen and put up the agenda for today. So the things we wanted to talk about, the letter to Mona Hazel and follow-up, if we can find that. We need to talk about vaccine protocols, and there is actually a new mandate right now that's come out. One of the things our hospice wanted to talk about are people having trouble rebuilding their volunteer force since the pandemic has hit us. I sent some documents that looked at 2 federations in our province, groups of hospices that have come together to form a federation, and we can talk about that. Also, IH contract renewals, I think, are up fairly soon. Is there anything else that people wanted to add to the agenda?
If I don't know if this is the right platform or not, but a while ago, I think it was in June or something, somebody from a hospice, and I can't remember who it was, indicated that they had done a benchmark, a salary benchmark for hospice EDs, and she was going to share it, but I can't remember who it was, and I never received it. So I'm wondering if that would be possible to get that.
Okay, so we can talk about that. I'll put that on the agenda. Anything else anybody wants to add? Okay, well, let's go for it then.
I apologize, but I'm just drawing a total blank. I don't have a letter of response from Mona. I don't even recall reading a letter of response from Mona. The only thing that is coming up on my end is the joint submission letter that was sent to everybody, like the final copy that was submitted to her, which would have been in early June. So if she responded, great. But has anyone seen that letter? I know, Gail, you have, but what did it say? Maybe that could rejig my memory.
It didn't say very much.
Okay.
Okay. We had asked for more support. We had asked for better communication. We had asked for, I think, just a more collegial kind of relationship. And basically my memory of it was a very short email response of, I'll take it to the people above and we'll look into it. So it really wasn't very committal to anything. I'll look again and see if I can find it. So I can resend that letter that we sent to Mona. And then I'm just writing that down, or my few brain cells will forget. And I'll look again for the response, but I don't know that I have it anymore. You know, she was glad to meet with us and talk with us, but there wasn't very much commitment.
If this was in an email, though, not necessarily an attachment.
No, it was an email response.
Okay.
Yeah, and maybe 3 or 4 sentences. So, okay.
So if I can just interject here, I've been able to dig it up. I think it's the one. And it's just like a 3-line response to Natasha. I'll read it if you'd like.
Sure,
Yes,
yeah.
please.
It says, hi, Natasha. If you can forward this message. At this time, there is no new information on regular volunteers returning to long-term care, AL, acute hospice, ... There is discussion at the Ministry of Health, but as of today, there is nothing new. There is another meeting tomorrow afternoon, but it is difficult to say if there will be anything new. Mona.
Oh, that's pertaining to volunteers going back into long-term care, et cetera, et cetera.
Oh, that's not because
No.
it's June. It's the date.
It's June?
Yeah.
Is that it? No, that's not it, Gail.
No, there was another short response,
Okay.
but yeah. So.
June 20, yeah, between June 7th and June 22nd. But that's all I have, so nothing else went out.
Okay, well, that conversation might have to be continued. I'm just going to go back, and if we could do a roundtable to just introduce who you are and which hospice you represent. And I'm going to call out the names as they came onto the list, and you can say just a little bit. So you'll have to unmute yourself. So we'll start with Bev.
Okay, Bev Peacock, ED at in Caslow, Hospice Society of North Kootenay Lake. And I'm like a 0.4 position, and that's it. We're just a little hospice, just trying to keep going and do what we do.
Okay. Jane? Where did Jane go? I wonder if she's stepped
No,
off.
I'm here. I'm
you're
here.
there,
I just was having, my screen went blank for a second. I'm
Okay.
Jane DiGiacomo. I'm the ED for Nelson and District Hospice Society. And we also are affiliated with East Shore Hospice, who's represented here today by Susan. Yeah.
Okay. Jen from Trail?
I am Jen from Trail. I am the hospice care coordinator. And I see some familiar faces.
Okay. And Carol?
Hi, I'm Carol. I'm from Merritt Hospice.
Great, thanks. Susan?
Hi, I'm Susan Dill. I'm from the East Shore Hospice. We're a tiny hospice. I only get like 4 hours a week, and we are only run by volunteers under the Nelson branch, which is Jane. Yeah, something similar to all the other little hospices.
We might be small, but folks, we're mighty.
Yeah.
Okay, Tracy?
Hi, I'm Tracy Haddo, and I run the 100 Mile Hospice here. We have a volunteer base. We have 3 part-time employees, and we've been at it for over 36 years here in 100 Mile.
Great. Donna?
Hi, I'm Donna Gordon, Desert Valley Hospice Society. Our office is in Osoyoos, but we serve the communities of Osoyoos, Oliver, and OK Falls. That's our catchment area. Hospice has been in existence since 2005, but physically very active and at this facility since 2013. We have 2 full-time staff, 1 part-time staff, as well as our Canada Summer Employment people or work receipt experience people. And yeah, so really find this very worthwhile discussion. I do have the HR from the question earlier. I'll have to look to see who that was from, but I do have it. And I might have Mona's response as well. I'll search my emails.
Okay,
Well, thank you.
thanks. And we're trying really hard not to be jealous of all your staff.
We don't have a lot, trust me. Not enough.
Yeah, never enough.
Yeah.
Krista?
Hi, I'm Krista Redman, and I'm the program coordinator for the NACUSP Hospice Society. And yeah, I'm pretty new to it. Just kind of, I guess, May I started. And yeah, very small as well. I think I'm the only, I work like maybe 4 hours a week-ish, and the rest is all volunteer and board. And yeah, our hospice has been fairly, I would say, inactive for a number of years now. There hasn't been a lot of engagement, and it's kind of my goal to get it up and running and thriving in our area. So yeah, it's me. Hi.
Thank you. I see a message from Jane. It would be helpful if people could rename themselves. And how you do that is if you go up to the very top corner of your picture, there's 3 little dots, and then you can go in and rename yourself. Okay, Brenda McLennan.
Brenda, you're muted.
Yeah, can you hear me now, Gail?
Yeah.
Yeah, okay. Hi, everybody. I'm Brenda McLennan. I presently live in Kimberley. I'm part of the Cranbrook Kimberley Hospice.
Great, thanks. And there's another Brenda Hooper. Oh, she can't answer right now. Brenda Hooper is the chair of the Greater Trail Hospice. So, okay, Natasha.
Natasha Gerard, ED of Central Okanagan Hospice Association. We serve Peachland to Lake Country.
Okay.
And we're going to be reaching our 40th year next year.
Great. Suzanne Leybauer. There she is.
Hi. I'm Suzanne Leybauer, Executive Director of Castlegar Hospice Society. We're coming up on, I think, 38 or 39 years in operation. I've just celebrated my 14th year here. We are located at the Castlegar Health Center, along with our fellow workers in home support, home care nursing, etc. So it's great to be in the middle of things here. We have been working as best we can throughout the pandemic. So I have a lot of very tired, burned out people amongst, along with myself. So I'm really looking forward to being able to go on vacation at some point, sometime, like everyone else here, I'm sure. So nice to see everyone.
And burnout might be something that we need to talk about as well if we don't get to it this time next month for sure. So, okay, Brian.
I'm from the Cranbrook Kimberley Hospice as Brenda. I'm a board member as Brenda and also active in our services that we provide.
Great, thanks. Robin?
Hi, I'm Robin Poser from Grand Forks. I've been the volunteer coordinator for about 2 years with our group. We're strong, like you say, strong but mighty. Our little chapter here was actually founded by Elizabeth Kubler-Ross, which is a little bit of an interest. She had friends here in Grand Forks back in 1988, and she just got together a little meeting, and lo and behold, about 20 volunteers came forward, and the group was very, very strong back in the day, but it's dwindling now. I have about 6 very active, committed, I might say, plus 70-year-old kind of volunteers who are all volunteered. They're all vaccinated and they're all ready to rock as soon as we get the green light from the Boundary Hospital here in Grand Forks.
Great. Great. Lisa?
Good morning, everyone. I guess it's still morning, isn't it? I'm Lisa Matthews. I'm the new executive director of the North Okanagan Hospice here in Vernon. Yeah, I'm about 5 weeks into my new role, so just trying to feel my feet, and it's lovely to be able to be part of a forum like this, so I can share some of, well, get to learn some of the shared experiences that everybody has. So I appreciate it.
Great. Michelle?
I am Michelle Nider from the Hospice Society of the Columbia Valley. So we serve the entire Columbia Valley, which is about, give and take, 10,000 people, permanent residents. When they're not, and if we include the non-permanent, then we're looking at summertime, maybe 30,000.
Wow.
It was absolutely insane this summer. So anyway, we're here, and this is a full-time position, and I have 2 part-time staff to help and a bunch of volunteers.
Great.
And it is a working board, by the way. So our board members, when they choose to being part of the hospice here, they have to understand that it is a working board. So they give a lot of hours as well to the hospice.
Mm-hmm. Yeah, we have a working board as well. Yeah. Anna?
I'm Anna Bockstrom. I am the ED for New Denver Hospice, and we serve the North Slocan Valley. And we just celebrated last year our 30th anniversary. And I'm the only staff.
Okay. And Carol? From
Hi, yeah, I'm in 2 places. I'm Carol, I'm in Merritt, and my boss is Jill, and I'm in Victoria, my boss is Jill, and she's in Merritt right now. I'm not sure if she's still on or she can unmute, but she's listening to the meeting from Merritt.
Okay.
And I'm out of office.
Okay, that's great.
Sorry.
Oh. Anyways, wonderful to hear from all of you. Some of you are fairly new or refurbishing your hospices, and then some hospices have been around for 30 plus years. So lots of experience, and it'll be great to share ideas. Let's go on and talk about vaccine protocols. And I'm just going to share screen again with the message that Bonnie Henry sent on September 13th. And so I don't know that we've actually gotten anything official from our health authorities, but what Dr. Bonnie Henry was saying is we'll be implementing a new order that makes vaccination against COVID-19 a condition of employment across all healthcare facilities in BC. This includes all workers, students, physicians, residents, contractors, and volunteers. This requirement also applies to those working at contracted facilities. So that would be the P3 facilities used by patients and at home and community care locations. Those who refuse will be put on unpaid leave, Henry said, but there will be accommodations made for the rare individuals who can't get vaccinated for medical reasons. And then, as we know, that it has been mandated for all workers and volunteers at long-term care homes. So I'm just going to, just a sec, I need to get everybody back on my screen here. Stop share, that's okay. What I'm going to do is I'm going to mute everybody. And when people want to speak, I would ask that either you unmute yourself, or the other thing you can do is if you hover over the reactions button on the bottom of your toolbar, you can raise your hand. And Natasha is going to help me look for the raised hands so that we're not too much talking over each other. But I guess I would open this discussion with saying, how is this impacting your hospices in terms of your volunteers now needing to be mandated? And it's not just volunteers, but it's staff for the hospice houses as well.
Suzanne?
Hi, I'm put myself back on the screen again. We put into place a policy probably 3 or 4 months ago as an addition to our risk management policies. That was an add-on to the COVID policies, that anyone wishing to either volunteer as a support worker or as a fundraiser or was employed by Castlegar Hospice would be required to be double vaccinated and would need to provide proof of that to us by the beginning of October. There has been zero negative feedback to that. In fact, all of the workers were very happy when we were able to get our first vaccine back in March, and everyone is double vaccinated right now.
Okay. Thanks. Jane?
Yeah, we're just about to consider adopting our official vaccine policy this month. So I'll be curious to hear what everyone says, but yeah, I mean, we have been requiring, of course, all of our employees who are working in residential care, they're required, or all of our volunteers working in residential care are required to be vaccinated anyway. So that's been fine. We haven't had a problem with that. I have been hesitant due to the guidance online from the BC Human Rights Commission to just kind of say, you know, you're required to do this or to ask people to give me the information. But I said, you know, if you want to do this work in hospital or in residential care or in people's homes, you have to be willing to reveal that that's the trade-off. So I haven't, the people who, they were sort of the usual suspects, you know what I mean? There were some people who I knew probably wouldn't get vaccinated for a variety of reasons, and they just didn't respond, which is fine, because unless I have proof that they've been vaccinated, they know they can't be placed. And so it's a kind of like, don't ask, don't tell kind of situation. And then, of course, in the grief setting, our work is all online, except for a few people who are still doing outdoor meetings, which they were doing anyway, because the numbers had gotten so high here in Nelson. So, so those folks are not required to be vaccinated. And if they're meeting outside, we're not asking them to do that. So that's where we stand right now.
Okay. Anybody else want to comment on how this is impacting your volunteers or your staff or whatever?
I can personally say that we've had, in Grand Forks, we have had 3 volunteers who have not got vaccinated by choice. We have one of our volunteers who actually had COVID. So I don't know if that actually comes under the immune categorized, and definitely she's not getting vaccinated, but she's had the COVID. So I don't know if that makes her immune enough, can I say, to, well, you're shaking your head, yeah. I felt it, but I just thought I'd bring it up. So,
yeah.
I mean, she recovered fine, but yeah, still no vax is no vax. So there you go. Thanks.
Tracy?
I have a couple of volunteers that do not want to get vaccinated. And I actually had an interview with somebody for upcoming training who has no intention of getting vaccinated. And at this point, we haven't established anything hard and fast in terms of our own policy. But I'm really curious. Like, I mean, there are certainly things that don't involve direct client contact that people could volunteer to help. But trying to figure out where you draw the line and all those other pieces right now certainly seems a little bit confusing. And we've always had a really good, strong volunteer group, but the last year and a half has certainly dwindled the people that we have. So I'm just kind of curious, you know, kind of like what other people are thinking, well, they can help this way or this way if they choose not to get vaccinated, or do you just kind of do a blanket and say, no? I'm just curious what other people think.
Okay. Donna and then Natasha.
We have a upcoming board meeting, so I'm going to ask the board as to the policy. What has really impacted us is we've applied for grants to train our volunteers, and our guest speakers have not been vaccinated. So we've had to take everything from in person back to Zoom because it was short notice. So that's really impacted what we had hoped would be, you know, in-person volunteer training, not the regular BCH-PCA training, but yeah,
Okay.
additional training. So that's really made us scramble at the last minute.
Natasha?
Yeah, we're considering everybody across the board here. And so I would love if Suzanne would be willing to share her policy, as my board has asked to reach out to some hospices that we're aware of in the Lower Mainland that have mandated staff and volunteers, not select staff or select groups of volunteers. And so Suzanne, if you'd be willing to share that with me, that would be great.
Yes, please.
I'm just also wondering if I had a conversation with someone at our hospital here yesterday, and because acute care is mentioned within this order, he actually shared with me that the hospital has not received any communication from the health authority about this order. The health authority hasn't given any information to the hospital about this order and what they need to do with it, which I kind of found quite interesting. I'm also have found this to be a little bit interesting that our health authority in terms of hospices have not given us any letter also communicated directly to the hospices about volunteers and vaccinations in these various care settings.
And I think, yes, it's come from Dr. Henry, but there hasn't been anything official from any of the health authorities, I don't think yet. I think it's more of a heads up that this is coming with some timed dates in terms of you have to have your first vaccine, I think, by October 1st, 24th or whatever.
September 14th, first.
Yeah, September 14th is long gone. So if people aren't getting their vaccine, what conversations are having with the various groups of people? Like, yeah, anyway, I kind of felt that was quite interesting in terms of IH's communication, but we haven't even received any direct communication around it either, in terms of for the volunteer piece.
It certainly does feel like the government's running to catch up. Like there's just so much stuff happening. I'm going to go in order of hands that I saw up. So welcome, Sandy. And if you wanted to speak.
I somehow got a message that said the host would let me in, and the host never let me in. So then I redid it and I got the same message, and I redid it again. Finally, I'm here. So I apologize for being late. Let me say that, first of all, just give a little background. I am also president of the Cranbrook Seniors Hall here, and we very quickly
Can't hear you, Sandy.
Yeah, can you turn up your volume, Sandy, because we lost you there for a minute.
Okay, can you hear me now?
Yes.
I sound like that commercial. Anyhow, as I said, I'm president of the Seniors Hall here in Cranbrook, and we very quickly made a mandate requiring full vaccination to become a member. Therefore, that means that you cannot enter the hall or be a member of the hall without a vaccination. Once, and I've downloaded the scanner and everything, so I have all of that. Once you are giving your membership, after we see your vaccination card, and if we don't know you, your healthcare card for a photo ID, then your membership card becomes what it takes to show that you have a full vaccination. Let me tell you, I've had 2 people who have not complied and I've said, well, I'm really sorry. When you do, you can come back. Otherwise, you can't. And they said, fine. I have had about 99% huge support from every activity, every leader that's in there leading activities, every person that comes in have just said, oh, thank God you did it. We didn't know what we were going to do. So then I turned to hospice and I said, we have to do the same thing. Clients and volunteers have to be fully vaccinated or they must work by phone. It cannot work in person. And we can do that. I've talked to Interior Health's hospice police person, and she said you can do basically whatever you want as you're an entity unto yourself. I haven't had a lot of pushback yet. I've sent the message out to volunteers and to the board. I haven't got anybody who said they're not going to comply yet. But as I said, I have my little scanner and I can scan their vaccination. And again, once that's done and put on a chart, then we know they're vaccinated. We are too vulnerable with the people we work with, that I work with in the seniors hall and in hospice, to allow anti-vax to rule our lives. It's time they stayed home and we got out. And I'm really adamant about it. And as I said, the support has been huge to continue that. So we're just pushing ahead. And I did ask Interior Health, as I said, COVID police, if, yep, you can do that, go ahead and do it. Thank God you're doing it. I went on a palliative rounds meeting with Interior Health and mentioned it to them, and every person in the room was thumbs up, good. On the phone, there were some people on the phone, everyone was saying this is the way to go. So this is the way we're going. If there is a person who needs special consideration, then for the seniors hall and for hospice, they're going to have to see me, and then we'll work with that.
Okay, thank you. Anna and then Jane.
So far, as far as our hospice goes, I have not asked. I've put it out to our volunteers that we can't enter the facility after October 12th if we're not vaccinated. And I've asked for volunteer compliance. I feel it's a violation to ask their status. I still also believe that the mandatory vaccines are a violation of our Canadian charter. So I've taken that position with our hospice. I ask the client and I ask the volunteer to, if there is a preference, if the client only wants a vaccinated volunteer, then that's what they get. If they want a non-vaccinated volunteer, then that's what they get. So far, everybody's been fine with that. I'm still reviewing it at the end of this month with the board. I personally am not vaccinated and I'm prepared to step down if that becomes an issue. I'm working from home. I don't go in the facility. I have a volunteer coordinator that's in the facility, and all the volunteers that are in the facility are vaccinated. But I have a health issue that I'm not prepared to take the vaccine. So I'm not playing hardball with my volunteers. I have a problem with the next volunteer training because my facilitator isn't vaccinated either. And I'd really like to do an in-person training, but I don't know whether there's any firm guidelines on that right now. Because there will only be a half a dozen people in the training, and I think we can do social distancing effectively, but I mean, we've done it before, but I don't know if there's new rules on that. Does anybody know?
There is for interior health that any organized event, people have to be double vaxxed.
In their facilities or in any facility?
Just generally, if you, even for small groups under 50, if it's an organized event, people do have to be vaxxed. And I'll see if I can find that reference again for you.
Okay.
Could you share that if you find it?
Yeah.
Thank you.
Send IH memo. Group fax. Okay, Jane.
Yeah, I just wanted to respond that, you know, to Tracy's comment that, you know, there are a lot of things in our society anyway that people can do without being vaccinated. So we are doing our grief groups online. So obviously anybody could facilitate an online group without being vaccinated, as well as there are lots of phone calls happening for grief support and online Zoom grief support one-on-one. So that can happen as well. And as I've said, if they're outside exclusively with their clients in a one-on-one setting, we're allowing that, but they have to tell their partner, their client, about their vaccination status, so their client is aware and is accepting of that. And there are actually clients who want that. I don't really understand that, but there are. So I feel like in some ways it's like the unvaccinated need a match with clients who feel that way too, who are kind of aligned with that. And then the people who are in facility, obviously there's 100%, has to be 100% vaccination, but you know, there are situations where this kind of situation can, this kind of person, this kind of volunteer could be useful. So, yeah.
In our trail hospice, we do have a policy that all of our volunteers that have direct client contact have to be vaccinated. And certainly any other volunteers that want to do fundraising or be on the board but don't have that client contact, it's totally up to them whether they want to be vaccinated or not. Where it becomes complicated is, of course, with your board. We need to meet together unless we're going to do it on Zoom. So, yeah. So I think Bonnie Henry's mandate is around direct client contact. Volunteers can do other things if there's not direct client contact. If everybody that has a policy or some kind of mandate could send that to me by email, then I'll distribute it to the group. And that gives you something to work off of if you're developing your own.
Thank you.
Gail,
Yes.
there's been a vaccine policy information that's been posted in the chat by Jane in a PDF. So if people wanted to check the chat.
Yeah, just because we're addressing this at our board meeting tonight. So I gathered the policies I could find on the internet from BC societies and the information from Bonnie Henry that you had shared with us, Gail, and then the BC Human Rights Commission position on requesting vaccination or on requiring vaccination from your employees. So all that information is in that. Not the first document was a pages document, but the second one's a PDF. So.
Okay, that's great. Thanks. The other question that we run into here, and I suspect happens for many of you as well, is some of our volunteers are wanting to know if our clients are vaccinated or not. So do we have the right to ask each client that is referred to us if they're vaccinated or not, or is that outside of what we can do ethically? Sandy?
They have the right to not answer. We have the right to ask. And the Charter of Rights does not put individual rights above the rights of the greater good. So the Charter really probably won't hold up as a reason. So yes, they can ask, and we can ask, and they can say they don't want to answer. that could be the answer that you're looking for.
Okay.
You know, so that's what I have found out.
And Anna is stating, provided there is sufficient proof that it is justified. Sorry, I missed part of that message. Hang on. No government, when challenged, has provided that proof. Okay. Jane, you have a comment?
Yeah, I just wanted to say, you know, we do get obviously all kinds of confidential information about people's medical status. And so I would agree basically with what Sandy said. We can ask, especially if we have a volunteer who doesn't feel comfortable being in the room with someone who's not vaccinated. But very often, or not very often, I would say in like half of our cases that we've had since, especially since the numbers have spiked up in our region, the clients have been really too sick to get vaccinated. And so we're kind of assuming they're not vaccinated. If they're not in residential care, so if they're in hospital or in home and they're quite ill, you know, I just feel like, you know, you can't assume that people in that position are going to get vaccinated. But what we do ask is whether the family who are going to be in the same environment, especially at home, are vaccinated, if they're willing to share that with us. And again, respecting that they may not be willing, and then we have to, or a volunteer has to make the decision about whether that risk is acceptable to them. So, so that's kind of, it is a bit case by case for us.
So would you have your volunteers sign a waiver then, if that's their choice?
No, because we're not anywhere guaranteeing that our clients are vaccinated. I mean, just like we're not guaranteeing that our clients can, you know, have other communicable diseases. I mean, we're not. I mean, you know, if you liken it, I know it's not the flu, but but if you liken it to before COVID, when every flu season, you know, whenever our volunteers wanted to go into residential care, to work with clients, there was a requirement that they be vaccinated, and there was an assumption that the residents would be vaccinated, but in other environments that wouldn't necessarily be the case. So, you know, you do get sick from various places. So yeah, we're not requiring a waiver from our volunteers, no.
Jane, I think you do make a good point, though, that, you know, sometimes our palliatives are just too ill to get out of the house to get the vaccine. Or, you know, some of them, if they're on particular treatment regimes, might not be able to at this point in time. So, yeah, that compassion, of course, is needed. Yeah. Any other thoughts or comments on this? These are muddy waters that we walk through, I think. So, okay. Brian? You're on mute. There, no, you're on mute again.
Okay, it's backwards for me. So anyways, I like the idea of giving the choice to the volunteer if we don't know that if they're vaccinated or not. The choice is theirs. If they still want that client, if you want to reach out for that client, then I think it's up to them that they make that decision. If they're totally vaccinated, i.e. the volunteer, then why not give it them their choice without having a black and white statement.
Another thing I would say that we need to think about, especially if you don't know if the client is vaccinated, I would really, really encourage the volunteers to wear N95 masks rather than the blue medical masks, or definitely rather than the fabric masks. The N95 masks are going to give the volunteer the best protection and also protect the client the best. And the reason I say not the blue medical masks is because most of the people that are buying those blue masks are not buying the medical grade level. And they don't fit snugly around the cheek. And so there's air that can come in on the side, and people are not wearing them properly because they're not snugging them on the nose. The N95s do give a snug seal around the face, around the cheeks and the chin. And so that is going to be your best protection for sure. The other thing about N95 masks is get the N95, not the KN95. The KN95 masks come from China. And so the level of quality is not assured by the KN95, whereas the N95s that are made in Canada or somewhere in North America are going to be much more effective for sure. So our hospice, if people don't have their own N95 masks, our hospice has a supply of those that they can use. The other thing about masks, sorry, this is the nursey part of me coming out, but the other thing about masks is when they get really very moist, they're not going to be as effective either. So I definitely would divert people away from cloth masks, but my preference, and the only thing I'll wear now is the N95 mask. Sandy, you had something you wanted to share?
Just one more thing. I think that we are dealing with vulnerable people in the first place. What would it be like if we did contact tracing and it was traced to our hospice, our volunteers or our clients? Our name would look like we're not even looking at trying to protect people. I'm really worried about that. And I find that most people who do not want to be vaccinated will work with online or will work with phones. And that's fine. But I just do not think that they can be in close contact at all, especially and the Interior Health isn't going to let them in the hospitals or the care homes. So it's got to be their own home. And I have a husband in care, and nobody's coming in here to care for him unless they're vaccinated.
Okay.
That's just the way it is.
Yeah, thank you. Michelle?
Yeah, I just wanted to pick up on what Sandy has just said. Ethically, as a hospice, I believe that it is my responsibility to keep our clients safe as much as I possibly can before I can even put a volunteer in there. You know, we provide training to our volunteers for that very reason, so we can make sure that we provide qualified volunteers to assist our clients. And I think that's the same with a vaccination. Ethically, I think that as an organization, if I'm going to support clients and people in the community, then I need to require my volunteers to be vaccinated. The old adage, my freedom stops where yours begins. And so, you know, we've been very, very strict with our protocols here with COVID. And right now we had a bereavement training on the weekend, and we ask our volunteers, the trainees, to prove their vaccination. We have a workshop coming up on Thursday on rainbows, children's grief, and it's in collaboration with the school district, and the school district is very strict about it. We have 30 people going, volunteers from the hospice, different people from organizations in the community and the school district, and they are all required to prove their vaccination. Basically, I need to protect others just as I need to be protected. So that's our stand.
Okay, thank you. Excellent sharing. Thank you very much. I suspect next month we'll be talking more about this, and I suspect that our health authorities will have more information about this as well. And I think Dr. Henry has given us a heads up that this is coming, but we'll see where it goes. So, and as I said, if people can send me their policies or their documents, I'll send them out to the group. So another thing that the pandemic, I think, has raised is being able to, well, losing volunteers in some cases. Either they're afraid to go out and be volunteers because of the Delta variant, or they're just exhausted because there's been so much pressure on the system. And then how do we rebuild our volunteer force? And when we were talking to someone from NOHA before, their volunteer roster had gone from 140 down to 30, which is excruciating. And I know we're having trouble recruiting people for our volunteer training. I just want to open a discussion about that. Are other people struggling as well?
I'll say we aren't. We're about to have a training at the end of September. Sorry, it's not the end of September, at the end of October, and then another weekend in November, and we don't seem to be having any trouble getting people. I think they all prefer that it be in person, so we're all kind of waiting to see if the numbers come down far enough for us all to feel comfortable being in person and being vaccinated, of course. But yeah, I don't know whether that's going to happen or not. We may have to do it online.
Michelle, you've got your hand up again.
We don't have problem finding volunteers. That's not our issue. We have good volunteers coming forward. Our issues is that we're not getting as many referrals as we used to, because I think that hospital and care homes are hesitant in providing the volunteers, so the clients, the referrals. So that is the opposite. You know, we have volunteers, we have people coming forward. You know, like I said, we just had a bereavement training over the weekend. We're having an anticipatory coming in October and an end of life in November, and we seem to be having volunteers coming forward, but we don't have enough referrals to provide them with clients. So that's the opposite.
Okay, so let's talk about that one in a minute, because I think that's not uncommon either. Jen, you had your hand up, and then Lisa.
We've probably lost a third of our volunteers, but a lot of them were, I'd say, close to aging out of their volunteer roles, as it were. We have had 2 volunteer trainings. We're halfway through a second set since May. And those volunteers have been super eager. And the volunteers we have left are like, hit the ground running. Where can I go? How do I get there? And I found to get into the facilities, I just have to be squeaky and go, hey, we're here. Do you have anyone? Like once a week, I'm emailing each one of the PCCs going, what do you have? Can we help you? What can we do? So it seems to work.
Okay. Lisa?
So here at our hospice, we've gone from 120 volunteers to 30 over the course of the pandemic. So quite a dramatic decrease in our volunteers. We've just starting up again. We've put on one course that's currently happening right now for 15 new volunteers, but we've got a long way to go to come back to where we were pre-COVID.
And Lisa, can you speak to why there's been such a huge loss for you?
Well, we had a lot of we had a lot of elderly volunteers, and with the COVID pandemic, they didn't see the risk. They perceived the risk to be too high for them to come and engage in our hospice house and go out to the communities. We've also got a vaccine mandate for all our volunteers. So there was, we had some attrition for people who didn't want to get vaccinated. Yeah, that's the majority of the reason we've had that much attrition.
Okay. Any other comments from anybody? Yeah, Brian. You're on mute.
We have a training that's going on in Cranbrook starting tonight, in fact. We've narrowed down the candidates just because of non-vaccination. We have 42 after, well, 46 after this training. My concern is because of the lack of clients at this time, that and the inactivity, that when the doors start to open, that we can be more effective, that they won't be available, you know, that their spare time has been caught up in something else. So it hasn't been a problem in the past, but I can see that we have to have our eyes open and be ready for that.
Okay. Tracy?
So I have tentatively booked a couple of trainings and each time have canceled. And the reason I've done that is, one, we've gotten bumped out of the space. So interior health has always been our space. And so we actually have to go rent a space somewhere else to do the training. I don't favor doing a Zoom training simply because we do a lot of interactive, and I very much feel that it's really important to have everybody together and to build that camaraderie, and for me to see them and to see their reactions. So I feel like the level of training just wouldn't be as good. And on top of that, what I really believe is if somebody learns new skills and they're excited and they're keen, and I can't put them into meaningful work right away, their confidence goes down the toilet. And by the time I can actually use them, they feel that they've forgotten everything they've learned and they don't have the confidence anymore. So I've tentatively booked another one for the end of March, beginning of April, because where we live, people don't drive in the wintertime if they can avoid it. So that's where I'm at. And I think at that time, regardless, I will find a rentable space and I will take my vaccinated keeners and I will do a small group regardless, so that I can get some of them up and running. Because I have people on a wait list that are really keen, but I just feel like it has to be good quality training and I have to have the ability to put them to work. So that's my thoughts, but it's a struggle.
So how many of all of our hospices are really struggling with getting referrals? Most of us? Quite a few. Okay. So what can we do about that? Because technically, we can go into all facilities if our volunteers are double vaxxed. We are an essential service. And all of us have got some volunteers that are double vaxxed. So how are we able to communicate this to our facilities? Anna?
We actually have a very active group in our friendly visitor program in the long-term care facility in New Denver right now. We've got like 12 volunteers going, at least 2 or 3 volunteers a day going and visiting residents without any trouble. They are vaccinated, but we haven't had any pushback. Actually, it's been super welcomed because they're experiencing staff shortages. So,
and although we're not supposed to be staff as volunteers,
it does help.
Yeah, for sure. Okay, Jane?
Yeah, I don't know how many societies have palliative rounds happening in their communities, community palliative rounds, but that has become our main source of referrals and connection to IH. So all I can say is, because we did struggle for many years for not so much from our residential care, we got lots of referrals from them, and we're starting to get those again, which is great now that it's clear, sort of the vaccination situation is clear, their residents are vaccinated and our volunteers have to be vaccinated to go in there. So that's been perking back up again. But in terms of home care referrals, that palliative rounds piece has been crucial. So if you don't have community palliative rounds, or if you have them and you're not participating, I would highly recommend participating. And I would say that, or advocating that you have them in your community. And if you are participating, my experience has been, it can be like, you can feel a little sidelined depending on how the rounds are run, and just in terms of the fact that they kind of tend to focus on medical symptom management. But if you have somebody good running it, then they'll also talk about the psychosocial aspects of that client's care. And that's your entree into, seeking referrals for those clients who need that. And also, I think it takes some time. Like if you haven't been in regular touch with the people participating in palliative rounds and you go for sometimes a couple of months, then a trust develops and they have a sense of what you do and what your, sort of what your wheelhouse is for hospice. So, yeah, I just wanted to put that out there in terms of getting referrals going.
And I think when they just visually see you or hear the word hospice, they'll think, oh yeah, because otherwise, yeah, they don't always remember. Tracy, and then Anna again.
We do, I attend rounds. I get referrals for every single person that gets put onto the palliative program. I don't have any problem getting referrals per se, so much as often families are kind of in their little bubble. They already have people in their bubble that they don't want. A lot of them are turning down home and community care because they don't want anybody extra in their world. So that's part of it at times. So when we have active cases in acute care, they're kind of saying, don't seek out coming right now until we know that they've cleared. So a little bit of that. A lot of the problem a little bit is as well is that the staffing shortage is so bad that a lot of the community clients are kind of almost falling through the cracks a little bit. And so there's those pieces as well. Yeah, I'm hoping for better times soon. I feel like it's definitely changing. The hospital here and long-term care is definitely functioning now with the mindset of how do we live with COVID rather than, how do we move forward with this? So I'm seeing a lot of shifts in the way that they're managing and thinking about it. The staffing is definitely a big issue. And we do have a few visitors that are going in to long-term care and doing family visiting. There's not as many people up there right now either. We've actually, yeah, they're not taking any new beds right now because they don't have the staff to manage. So we have a whole wing that's actually closed down in long-term care. So there's lots of different dynamics going on for sure.
I think that's a good point. This is a multi-level problem. And the staffing issue, either the staff turnover or the staff burnout, or just the general chaos, I think contributes to that as well. And so, yeah, they just forget about us, I think, some of the time. Anna, again?
Yeah, we have an interesting situation, and I appreciate what Jane said about the rounds. I have asked multiple times to be included in the rounds invites. And because the nurse in charge says, well, it's rounds, it's not just palliative rounds. So if we have a palliative client and that comes up, we'll let you know, but they never do. So I cannot seem to get an invite to the rounds. And because we don't have a community health nurse right now, and we don't have care aides right now, there are a lot of cracks in the system that I find myself filling. So I'm in communication with the community health nurse in the cusp, who is using me to reconnaissance, basically, to keep an eye on people and give her the heads up if things are getting unmanageable. It's insane. But in terms of getting into rounds, I just haven't had any luck at all. I don't know what the problem is, but
I think you would have to talk to Elizabeth Antifo about that, because she's the one that's the lead for palliative rounds.
well, I got her to send the memo. That didn't help. Then I talked to the person below her. That didn't help. Yeah, I don't know.
Well, just to be clear, Anna, we're not participating in general rounds here in the hospital. It is very specific to palliative patients. So
that's
I don't
my
know.
problem.
Yeah. So if you, I mean, I would say that, you know, you could try to bring together, you could try to get Elizabeth to bring together a group of people who would be appropriate for community palliative rounds, say for New Denver and the Cusp, you know, so like maybe joining with another smaller community that's nearby you might help you generate the kind of attention and kind of need for it, because I think that could be a challenge.
It is. It's because what they do is they combine the general rounds and palliative rounds, and so because I'm not welcome in the general rounds, I just don't get any time, and I don't think that that's going to change. So
I would talk to Elizabeth about that. I would make that 100% clear to her that they're combining the two rounds, and because there should be, the way the other community palliative rounds are being run is there's a standing invitation for hospice, the local hospice society, to participate. And so even if it's just that they have the, you know, the last 10 minutes of their agenda as palliative, even if there are no clients discussed, you should be able to join that call or be in that room for those 10 minutes. And what happens often, I find, is that it's not so much that new clients are coming up every day or that every client that's being discussed is being referred to us, but it's just the familiarity with who's coming through. And, you know, you might, just having you there, the presence of you there might kind of remind people, oh yeah, this person probably is palliative or could qualify, and maybe they should be referred. So I would go back to Elizabeth and explain specifically the situation, do it in a phone call. She's really great, and she's very motivated to get these palliative rounds in the communities working well.
yeah, okay, thanks. I'll call Elizabeth. I had emailed her and she sent forward the memo, but that didn't have any impact. So yeah, that it's a good idea. If they could even just separate it out into a specific time. One thing I am finding is because they're so short-staffed here and they're starting to rely on us to kind of keep an eye on certain individuals, I am developing a relationship with the long-term care or the community care nurse in the Cusp, and she's starting to give me a lot of referrals, but sometimes not in my region.
Tracy, did you?
I just wanted to share that prior to 100 Mile adopting the palliative rounds, I would attend the home and community care rounds once a week, and they would just do all the palliatives for the first part of it. And then I would attend that, and then I would leave, and then they'd carry on with the rest. And it was really nice, and it was great because that helped us to stay connected more with the home and community care nurses. And it was a really nice working system. So maybe if they would just shift it for you, if they can't split it, that would be wonderful.
Yeah, and I think that's a good other way to do it if you don't have palliative rounds in your actual locale, to see if home and community care could do palliative rounds at the beginning or end of their day. Yeah. I just wanted to go on one of the things Suzanne mentioned. So Suzanne, pop out behind your camera again, was the whole idea of burnout. Are you finding that staff are feeling burnt out, that you're feeling burnt out, that volunteers are feeling burnt out? How big of an issue is this? And is there some way we can speak to it or address it?
I'm feeling like it's a general burnout of everyone at this point. because we have provided services as best we can throughout the pandemic. And of course, we've been back in facilities and back in homes for a while now. You know, there's certainly added pressures on everyone. We've had a phenomenal increase in doing grief and bereavement support because, of course, now we're taking on COVID grief. And in this area, there's also been a large number of deaths due to overdoses. So we're taking on that as well in a larger capacity. And I'm working with more organizations, which is good on its own. But of course, you know, we are all under the burden of COVID personally. And then when we take it on professionally as well, it's been a lot. And Gail, you know, I've talked to you about it as well. So you know the pressures that I personally have been feeling. And I found it, and this is kind of ironic, as you know, IH has said that they have different things out to help employees and contractors with stress and burnout. And there was a day that I decided that was it. I just had to go and I had to look at something. So I went online to the site and I clicked on one of their resources for stress and burnout. And lo and behold, up on my IHA computer came, IHA has filtered out this site due to spam. So they were blocking their own site for stress help. So, you know, that gave me a great laugh. So I guess at the end of the day, it did help. But I don't know. I mean, we're at such a different part of life right now. And I think we're all kind of going by the seat of our pants, and we're all trying to figure out things as we go. So maybe there's, you know, others of you out there that have found something that, you know, helps with your stress, helps with your burnout. You know, there's been days, and I'll be very honest, that I have thought I cannot go on. I literally cannot go on in this job, period. So has anyone else felt that way? And what have you done? I know since COVID has started, I have 17 new pairs of shoes. So I'm like the queen of online shopping now. But there's you know, there's other ways as well. So I don't know, Gail, what else do you want from me?
Well, I'm just wondering, is this an issue across the board, or is it, you know, just a few that are feeling that?
Well, I would say in terms of the volunteer support workers, I have, although there's a number of them and I haven't actually lost any of them, there's really a core group, you know, that have really been going above and beyond. And I can sense that they are feeling the pressure now as well. So I'm really trying to limit what they have to do. But, you know, with new clients, and as I said, especially our grief and bereavement coming in all the time, it's challenging.
More pressure. Donna, and then Jane, and then Natasha.
Right. Did you mention me, Gail? Sorry.
Yes, Donna.
Okay, great, thanks. One thing that I'm finding, or we're finding with our volunteers, our volunteers have volunteered primarily at the Soyuz vaccine clinic, 2 to 3 shifts a week, 2 volunteers per shift. And so that has lessened now to 1 volunteer per shift, but still twice a week. So our volunteers have been doing that since March. A couple of the volunteers are volunteering in the Oliver vaccine clinic. And so our volunteers are burnt out because of the IH vaccine clinic. And now when things are starting to open up and roll out a little bit, and it's now September, we're shortage of volunteer for our referrals because they've been burnt out fulfilling an IH, what I feel is position.
Okay.
mandate. Yeah, so that's stressful for us because now we have no volunteers.
Natasha and then Jane.
We started a conversation a couple of weeks ago with one of our grief counselors, not just so much about our organization and feeling the longevity of this is very tiring and just different recent situations and healthcare workers and we kind of got talking in terms of like, what is it that people need? Do people know what they need? Do they have the space to kind of know what it is they need? And so we've kind of looking at offering something to anyone, you know, whether it's frontline workers, volunteers, healthcare professionals, funeral directors, the whole gamut. I mean, we're all facing it in some form or fashion. And so we went away with some homework to connect with some various individuals in our community to say, hey, what is it that you're experiencing in your workplace? What is it that people are asking? Are they not? Do people know what they need? So my conversation yesterday with acute care was, tell me what's going on with everyone in our acute care hospital. So definitely some themes around exhaustion, some things around inpatient. People aren't having the conflict resolution skills any longer because they have become impatient. Therefore, they don't feel they're coming across kind or compassionate towards families. There's a little bit of headbutting in terms of various opinions around vaccine versus non-vaccine individuals. And so, you know, I kind of thought, you know, just change, ongoing change has been a lot. So what I kind of took away from that, and then what I shared with the counselor, because we're sharing this information as we get it, was just in that conversation alone is that people are just purely exhausted as a whole, or, you know, building resiliency, or how do we build our patients up again? I'm an extremely patient person. I notice that my patience level is nil, and that's not like me. The other thing that we've talked about is self-compassion is, you know, if we're not doing what we think we should be doing or at our full speed of what we should be doing, is just giving some self-compassion to self and reminding ourselves that, you know, we are in this too, and we are doing our best. So we are kind of coming up with some ideas. So this conversation is very timely in terms of what is it that we can coordinate some professionals to maybe do a little 40-minute, half hour over a Zoom, maybe a series over a couple weeks. One of the challenges that I talked about yesterday with Derek was the time of the day. They're finding people in acute care, when they have their breaks, they don't want to be getting on a Zoom call. They don't want to be going to a stress reduction seminar in the hospital that they're putting on. They are wanting just to take time for themselves and just to be alone and just to have their lunch, their break in their own quietness. So kind of food for thought, but that's something that we're kind of considering doing. It's not going to be any charge to anybody, but I would really love some feedback on that. And I just want to mention, Suzanne, I have a app on my phone called Calm, CALM, and it's a great app. It's got a short little 10-minute little meditation verses. It's got music. It's got some sleep, you know, how to improve sleep. It's just a great kind of overall app that might be kind of helpful. It's just something to maybe start your day with, a little 10-minute sort of meditation and just some breathing techniques. It's kind of helpful, and And yeah, that's it.
Thanks. I'll come to Jane and then Suzanne in just a minute, but two things out of that. If you have stress-related resources, not just stress, but stress-related resources to minimize that, also send those links to me and I'll just make up a resource list that we can circulate because everybody finds their own little things. And I think if we have a broader resource list, it would be helpful. That was one of the two things. What was the second one? It might be something to think about that if we developed little 10-minute video clips about building resiliency and stress reduction and those kinds of things, and just had them on a YouTube channel that people could access, whether it's acute care staff or whether it's our hospice volunteers or palliative rounds professionals or whatever. If we had a little repository and everybody took turns developing things if they wanted to, then people can access them when they need them. I agree, they probably want their breaks when they need their breaks, but I think people don't know where to go to get those little boosters. So that might be something for us to think about in the future. So I see a whole bunch of hands up. Jane is next, and we have about 7 minutes. So
yeah, I'll keep it really short. I just wanted to say that we obviously have been seeing this in our community. So we decided to use the resource that I posted in the chat, which is the Compassion Resilience Toolkit. It was developed out of a university, I believe, in Wisconsin, and originally it was developed for education, but they've now adapted it for human resource app or human, I can't remember if they call it human resource management, but anyway, it's sort of a broader resource now. We used this toolkit this spring in a course we did for the staff at one of our residential care facilities here in Nelson, who were experiencing extreme burnout, loss of staff, really in desperate measures. And we happened to get connected with them through their social worker. And we came in with our volunteers and ran this compassion resilience course for them. And it has some really great tools. And so I then began doing it in my volunteer group. So now when we have our monthly meetings, we do a piece of this compassion resilience every time. And sometimes the exercises are as short as like 20 minutes. So it's just another way to check in. Like, I know we check in our volunteer gatherings, but it's a different way of approaching that and actually getting people to sort of unpack a little bit, sort of like what you said, Natasha, what is it that is causing me to feel this way right now, and sort of connect back to some maybe past history, their experiences with trauma maybe. So I've found this to be a great resource. So if anybody wants it, it's free, you can adapt it for your setting. And the other thing I want to say is we did some really great work with a local psychologist on vicarious trauma. And vicarious trauma is something that probably all of our volunteers and we have experienced whenever we've been through trauma. And now as a community, as a world, we're experiencing it through going through COVID. And its impacts can be quite devastating for people, just the same as trauma can be for people. You don't have to be directly up against the trauma to experience those impacts. And she gave a, one little 1-hour talk, and it was just like really quick, brief things, kind of like you said, Gail, little exercises you could do in the moment when you're feeling that way to move traumatic responses through your system so they don't linger and stay with you. So I just wanted to say those are the two things that I've used, and they've been really super helpful for us.
Okay, thanks. Suzanne, and then Sandy, and then Tracy, and then we're done.
Okay, I will talk fast. Just on another aspect of what we have seen and we've been dealing with, people are burnt out, and there's certainly, some aggression and some anger and whatnot. We've all seen it go towards people in retail or, everywhere. And certainly some of our volunteers, as well as myself, have felt it as well. So I did a workshop on verbal de-escalation, not only for our volunteers, but for the Chamber of Commerce as well. And some of the local businesses attended it. I am certified to train in that area. So just want to put it out there to any of the places that are close to us. If you would like some information about it or would like me to come in and talk to your groups, just let me know. Thanks.
Okay. Quickly, Sandy and Tracy, and then we've got a question on the chat.
Okay, I just want to tell you a quick story that maybe will lift your spirits just a little bit. We were not working in the hospital gift shop till quite recently, and then only 3 days a week for a very short time. But during that time, a friend of mine phoned who was quite exasperated by the protest why it went in front of the hospital, because it did a lot of harm. I was working that day and people couldn't park who had appointments and so on and so on. But she said she wasn't able to travel. What could she do to support every worker in our hospital? And I said, well, through the gift shop, the thing that the workers come and buy all the time are the little 25-cent candy chocolate bars we sell, because they can just give them out to their groups and so on. So she gave me a bunch of money and said, go do that. I went and got numbers like from housekeeping of 45 to the social workers of 8 and whatever, and took them around through this anonymous volunteer through the hospital gift shop. You can't believe the number of smiles and thank yous that went on for these little 2-bit chocolate bars. Just the thought was there, the thought that someone did something. Hey, I felt great because I was on the receiving end of all the thank yous. And just taking myself out of myself and doing something for someone else. Although I did tell my friend that she had the easy part because she just had to give me money. I had to run up and down floors and anyhow, it was a wonderful experience. They were all thrilled by it. Emergency, they made me walk into the staff room and pile them up on the staff room table, and just the feelings that they were appreciated with a small token. Maybe that's a way to get out of your stress, and I don't know, I'm an optimistic sort of person anyhow, so I'll just go on that, and helping others is maybe the way to do it. Sorry, thank you.
Thank you. Yeah, I think everybody needs to feel appreciated right now. There was a question in the chat. Does anybody have any information about ED salaries in the province? Does anybody know what the salary benchmark is? Natasha, have you heard anything about that?
No, but I think Donna said that she was able to get it. It was someone from the Lower Mainland who did a review within their organization. It was mentioned on the BCHPC leadership team meeting last week. I've also purchased the Charity Village 2021 salary review for Charity Village. I'm happy to share that as well because it's a not-for-profit platform. So it actually is quite interesting too in terms of varying scaling of salaries and dips and increases, etc. So I'm happy to share that with you, Gail, to send out to everybody.
Yeah, and Donna, if you could send me what information you have about salaries, and then Natasha, if you could send that as well.
Okay,
And then,
I did email it to you, Gail. I emailed it from my personal email. So I just sent it, well, a while ago now, an hour ago. Yeah,
I haven't seen my email an hour ago.
I know.
Okay,
it's from Crossroads, so I just sent what she sent to me because I did track her down.
Okay, perfect. That's great.
Okay, Gail has it now.
Okay, I'll send that along. We're out of time, unfortunately, and we didn't get around to talking about federations or contract renewal. So let's start with that next time. And any resources that you've got that you want to share with the other hospices, please send them to me. That would be great. I'm glad we had the discussion we have had. I think we need to look at federations as a potential possibility, but I think we needed to talk to some of the stresses that we feel in the moment in terms of volunteer training and all of the other things as well. So I haven't done a very good job of running the meeting because we ran out of time, but I thank you for the discussion. And if you've got anything you want to send on, send it to me and I will do that. So,
Thanks, Gail.
have
Nice
a
to
good day,
see
everybody.
everyone. Bye-bye.
Thanks, bye.